Well, hello, everyone around the world, wherever you might be. I am Jay Campbell, and I am joined today in my virtual studio by a very, very brilliant woman and researcher. Her name is Doris, if I pronounce this right, Guys, let me just tell you guys a little bit about her bio real quick. We're very blessed and privileged and humbled to have her here today. She's an independent researcher and writer specializing in the investigation of familiar and innovative health topics using unique perspectives in traditional and quantum biology. She's actually a trained classical pianist, but this has allowed her the freedom to explore concepts and theories with a curiosity that often results in very distinctive conclusions. She's written some amazing things. I'm going to actually share at the end of this where you guys can find much more about her research. She's written about 5G and the vitamin C connection. I mean, there's so many other articles that she's written. I wrote a blog earlier this morning linking to all of her previous publications and articles that she's written. Again, she's written so prolifically, and it's an honor to have her here today. So with that said, Doris, I'm going to turn this over to you. Now, everybody, there's a lot of people watching. So if you guys have questions, okay, we will get to them at the end, but I ask you right now to allow her to share her presentation, her slide deck, and I will moderate the discussion. I know there's going to be a ton of questions, but please, it's very, very important that you share this information with your family, your friends, loved ones, and especially people in the medical community, because this is definitely an intervention that works. And with that said, without further ado, Doris, please take over.
Thank you, Jay. I'm really honored to be here today with you and Dr. Wilgers for this important live stream event. Now, my last research paper explained why I believe oral ascorbic acid is different from buffered forms like sodium ascorbate used predominantly in IVC injections. Today, I will explain why I believe we must use ascorbic acid in the oral form to combat COVID-19. All the information today has not been covered before, so I will try to focus on only the new information and be brief on things that the audience are familiar with, like ARDS, acute respiratory distress syndrome. Okay, here we go. This is the title today, COVID-19, ARDS, and cytokine storms. And the focus is actually on the recycling of ascorbic acid by immune cells like macrophages, neutrophils, and lymphocytes. My latest research shows that all the mechanisms used by COVID-19 to attack the body actually involves the depletion of ascorbic acid. The depletion of ascorbic acid results in the failure of the immune system that leads to severe and often lethal pathologies such as ARDS, sepsis, multiple organ failure in COVID-19 patients. Today's presentation will show how ascorbic acid deficiency in white blood cells like macrophages, neutrophils, and lymphocytes result in their dysfunction. Now, these cells, macrophages, neutrophils, and lymphocytes, they all produce cytokines. Cytokine storms from immune cell dysfunctions actually contribute to the collapse of the immune system, and that is the ultimate cause of fatality in COVID-19. As we all know, COVID-19 patients, if they are affected severely, they get ARDS.
Right.
So, okay, very quickly. When you have ARDS, you will have low oxygen, low nitric oxide. Remember this, very important, low nitric oxide. You have high sepsis and high inflammatory biomarkers. And the higher the inflammatory biomarkers you have, the higher your mortality rate and the increased need for the use of ventilators. And what does ARDS do to your lungs? Now, this is a very interesting development. A patient can test negative for COVID-19 but show abnormal lung CT scans. Now, the SARS-CoV-2, now that is the name of the virus. The disease caused by SARS-CoV-2 is COVID-19. The SARS-CoV-2 virus uses a multi-pronged strategic attack system. That's why lungs are affected so much. Furin enzymes not only activate SARS-CoV-2, they also activate important biomolecules like growth factors, hormones, and pro-inflammatory cytokines. Now, when this paper hit the press on March 23rd, it changed my whole conception and understanding of the SARS-CoV-2 virus. They actually use viroporins to attack hemoglobin and create cell-free hemoglobin to cause ARDS. Now, after they attack the hemoglobin, you end up with cells that are not stable, heme cells that are not stable. And these heme cells, they actually decimate nitric oxide. And more SARS-CoV-2 virus will end up with more cytokines.
Right.
And why is there a lot of ferritin? Because ferritin is used by our bodies to bind free iron. Free heme just decimates your liver. So liver is probably the start of heme destruction and the perfect cytokine storm. That means if you have high ferritin, good luck to you.
Right. And who is a person, so just to, real quickly, who is a person that has high ferritin naturally? A very inflamed, infirmed person, but like specifically, we're talking about like really advanced stage diabetics, insulin resistance, right?
Yes, inflammation, right. Yes. Why? Macrophages, they depend on ascorbic acid to generate nitric oxide. So if macrophages are unable to generate enough lethal oxidative bursts due to a lack of nitric oxide because they don't have enough ascorbic acid, not only are they unable to kill pathogens around them, their numbers will keep on increasing because there is no negative feedback loop of the monocytes that produce them. Are you following me, Jay?
I am. Absolutely. Whether the audience is or not, I don't know, but I'm definitely.
I mean, this virus is like amazing.
Yeah. So
nitric oxide deficiency in macrophages from insufficient ascorbic acid is probably one of the reasons how cytokine storms are exacerbated in COVID-19. And that is also why you are now seeing a lot of hospitals and a lot of clinical trial applications on using nitric oxide. And lo and behold, nitric oxide derived macrophages are found in extremely high levels in severe ARDS cases in COVID-19.
So let me hammer that point home. So guys, when you have an uncontrolled cytokine storm in your tissue, you are at extreme risk for all sorts of, basically physical breakdown. If you're an inflamed person and you're having a massive cytokine storm, then you can literally have a heart attack, an embolism, a stroke. I mean, I can name 100 other things that can happen to you. So what she's saying is you have to stop the cytokine storms when you are at an advanced stage of having COVID. And obviously C does that. Anyway, continue.
Right. Okay. So now I'm going to tell you why you absolutely need ascorbic acid and ascorbic acid only for nitric oxide, and why macrophages take up so much ascorbic acid and they have nothing to show for it because they use it all up to produce nitric oxide.
How many people that were diagnosed with pneumonia actually had COVID, but they just didn't have a test or an awareness of it at that point, in your perspective? Right.
In COVID-19 infected patients with pneumonia, they have a much lower lymphocyte count compared to patients with pneumonia that's not caused by COVID-19. Because remember, ascorbic acid increases glutathione. And when lymphocytes, they don't have enough glutathione, their numbers will plummet by 75% in just 3 days.
Wow.
So if you don't have ascorbic acid to make glutathione for lymphocytes, you will not have lymphocytes. And then your neutrophils are going to be all the way up there, and your lymphocyte count is going to go all the way down. Now, in my mind, as soon as you're infected, if you take oral ascorbic acid, you may never get to the stage where you need an IV drip.
And that's the most important
IV drips are only for people in critical care,
right,
that have lost a lot of functions and they can't breathe and their lungs collapsed, and they probably can't even take oral ascorbic acid. So giving them drip is going to revive them so that to the point that they can start taking oral ascorbic acid. And when you give them oral ascorbic acid, they're going to recover at twice the rate. I mean, maybe even 3 times. I'm just so sure about this.
Let me repeat what you said. And obviously, I've been pushing your stuff so hard for the last 2 weeks. Use vitamin C, everyone, right now.
Ascorbic acid.
Yes. Make sure that you have ascorbic acid and that you're using this right now, okay, as a preventative. And we'll get the dosages and stuff by the end of your presentation, but just you won't have to worry about it if you're using it.
Yes, absolutely. Okay, so the difference between oral ascorbic acid and IV sodium ascorbate is actually the pH. Ascorbic acid, the pH is about 1.0 to 2.5, and sodium ascorbate, the pH is high, 5.6 to about 7. And in your blood, you can't really inject ascorbic acid because it's too acidic. So you need something with a high pH to mesh with the physiological pH of the blood. But that is not the only difference. Molecular structure. Ascorbic acid has 6 carbons, 7 hydrogens, and 6 oxygen atoms. Sodium ascorbate has 6 carbons, 7 hydrogens, 6 oxygen, and 1 extra sodium atom that replaces the 8th hydrogen in its parent. This is the extra sodium ion. And it actually makes a whole lot of difference because it makes the molecule a lot more reactive. It changes the reduction potential. And until this earth-shattering to me paper came out, I had no evidence to say that the body, human body, cannot use sodium ascorbate in the same way as ascorbic acid, in that we regenerate and recycle as sodium ascorbate. This is that groundbreaking, earth-shattering paper by Dr. Owen Fonarow and Dr. Stephen Hickey, released on March 13 in the Townsend Letter. What they did is something really ingenious. Now, ascorbic acid is produced from glucose, and that's why sometimes when you use glucose meters, you get false readings because it's picking up ascorbic acid. So they use this feature and measured minute-to-minute fluctuations in the blood. Now, this is very important because nobody has ever measured minute-to-minute fluctuation. Now, this is a chart of ascorbic acid and sodium ascorbate. Both are oral, taking in 10 grams in one go. This is the 2nd minute mark. Look at how much ascorbic acid goes into your blood. Boom,
That's
2 minutes,
amazing.
2 minutes, 2
Amazing.
minutes. Second minute, the minute you take it, it goes, whoom, goes into your blood. And then what happens? It disappears. What happened to it? Well, all the cells took it up to use it. And then they regenerate and release it back. And that's why you see this whoops, it goes up again. But then the successive peaks and valleys, they diminish because at some point you're going to use it up and you can't regenerate it. So that's why you have successive peaks and valleys of diminishing intensities. Now, this is the price chart. Sodium ascorbate IV and ascorbic acid taken on 3 occasions in the same person. Look at how much ascorbic acid goes into your blood on minute 2. Boom! Amazing. Then it goes way down. So if you took a reading of ascorbate in the 14th minute, you're going to say, oh, IV sodium ascorbate is much higher than ascorbic acid. Well, yeah, you're measuring it at the wrong time. And look, regeneration, reuse, regeneration. This is why I firmly believe that our body can only regenerate and reuse ascorbic acid. This is that beautiful, beautiful chart, and I love Dr. Frohner and Dr. Hickey for the rest of my life for doing this. I mean, I'm serious. I mean, they are heroes. I mean, they are going to change also molecular medicine. I mean, I'm serious.
Doris, in case you don't know, you're a hero too.
No, I'm not. I'm just like,
oh yeah, you are, dude. Sorry.
No, I'm not. I'm just using the work, the lifelong dedication, that work produced by other people, and just putting it together. I'm just a messenger.
You're standing on shoulders of giants, right?
No, I'm nobody. Forget me. Just get this information, spread it out, and save lives, Jay. I mean, this is going to save lives.
You are. So continue.
Okay, ascorbic acid, they cannot be replaced by similar molecules, including sodium ascorbate, due to its unique molecular structure. And now I'm going to show you some really fascinating photos. They took ascorbic acid in the L-ascorbate form. Now, a lot of people say, oh, what is L-ascorbate? L-ascorbate is a natural form that is found in nature. And anything you buy on the market is going to be L-ascorbic acid. You cannot get D-ascorbic acid because it's totally synthetic and needs to be created in the lab. And if you buy it, it's going to cost you an arm and a leg. So you're never going to get D-ascorbate. Right. And they also show that the HIF protein does not respond to other antioxidants like NAC. Only L-ascorbate. Okay. A perfect docking of L-ascorbic acid. And D-ascorbate, look, it's all crooked, doesn't fit. Fit? No fit. I'm going to summarize today's presentation on the primary attack mechanisms of COVID-19 and how they can be neutralized by ascorbic acid. Number 1, the SARS-CoV-2 virus infect and replicate in lungs using spike protein that binds to ACE2 receptors. SARS-CoV-2 attacks heme using porphyrins as Trojan horses to infect the cells. Cell-free heme in the lungs cause damage to cell linings. And there was a brilliant study done not more than 2 years ago that actually showed that ascorbic acid can reverse and inhibit specific damages inflicted by cell-free heme in lung tissues. That is why I say, people, when you are infected, take ascorbic acid, because even if you have cell-free heme, it's not going to destroy your lung cells because you have enough ascorbic acid. Take this message home. Next one. Cell-free heme do not carry oxygen. And the lack of oxygen activates the hypoxia pathways that can increase urine enzymes that will activate more COVID-19 virus as well as pro-inflammatory cytokines. And only ascorbic acid can prevent the stabilization of the HIF-1 alpha complex to maintain furin enzyme homeostasis. Now, there are some studies that are talking about furin enzyme inhibition, and I think that's a wrong approach because furin enzymes are necessary to maintain other biomolecules like growth hormones, cell receptors. You cannot be without furin enzymes. What you need is a balance, and ascorbic acid will balance it. Cell-free heme destroys nitric oxide at 1,000 times faster than normal heme. Now, this destruction of nitric oxide will lead to the depletion of ascorbic acid as it is required for BH4 regeneration. Just imagine, all of a sudden, your body is drastically low on nitric oxide. So all your cells that normally make nitric oxide is going to say, where's my ascorbic acid? I need more nitric oxide. And everybody starts grabbing ascorbic acid. And this is where ascorbic acid starts to become low. And that is also why in cell-free heme, they're found to deplete ascorbic acid. And when your immune cells are out of ascorbic acid, good luck to you. So this depletion of ascorbic systemic depletion of ascorbic acid will affect all immune white blood cells, including macrophages, neutrophils, and lymphocytes that depend on ascorbic acid recycling to produce nitric oxide, NADPH, and glutathione. Now, increased ferritin results from increased macrophages produced in the liver that capture free iron dislodged by the COVID-19 viral porins. Liver damage, uncontrolled release of NLRP3 inflammasomes, and the increased secretion of cytokines continue when these monocyte-derived macrophages produced by the liver cannot be destroyed with the negative feedback loop using nitric oxide oxidative bursts. Increasing ascorbic acid will allow macrophages to produce these lethal oxidative bursts that kill not only COVID-19 virus, but their own parents, the monocytes. And then that effectively stops the cytokine storm. It's like you have macrophages going, boom, I kill everybody. Okay, I'm done, finished. That's how normal immune systems respond. And that is why when you have a cold or a flu, if you take ascorbic acid, you heal faster, you get well faster, because these inflammatory responses end faster. Lack of glutathione causes functional exhaustion of lymphocytes. Increasing oral ascorbic acid increases glutathione levels by raising G6PD expression, leading to more NADPH production, and increased glutathione results in normalized lymphocyte count, which is very, very important in COVID-19 patients. Now, the lack of nitric oxide and glutathione limits the ability of neutrophils to migrate and to produce lethal oxidative bursts. And without NADPH, neutrophils are unable to generate superoxide to kill pathogens using extracellular traps. Ascorbic acid can increase nitric oxide, NADPH, and glutathiones in neutrophils that support their functions so that they can kill those nasty SARS-CoV-2 viruses. So that is why I believe that combined use of oral ascorbic acid and intravenous sodium ascorbate is the perfect two-pronged strategy to attack COVID-19. Now, I must emphasize the following are recommendations for initial COVID-19 infection and should not be regarded as medical advice. So, if you just got infected and the cytokine storm hasn't started, you can take an initial dose of 3 grams, followed by 1 to 2 grams every hour, depending on, you can see how well your chest feels, if it's starting to feel looser, if you can breathe. And you can repeat this cycle every 8 hours until you are completely without symptoms. Once you are symptom-free, please go back on the maintenance routine of 1 to 2 grams per hour for a total of 8 to 12 grams per day. But mind you, make sure when you are symptom-free and you go back on your maintenance dose to take a higher level of ascorbic acid than before you were infected. Because if you got infected and you show symptoms, that means your ascorbic acid level was not high enough. Now, this is recommendations for severe COVID-19 infections and should not be regarded as medical advice. I have to be clear, it's not medical advice. Now, some people have reported that as soon as their ascorbic acid level drops, the shortness of breath symptoms returns immediately. So if that should happen to you, as soon as you say, oh my God, I can't breathe, take a hammer dose of ascorbic acid, 3 to 5 grams, just down the hatch. Now, during critical infections, you will essentially have an unlimited tolerance for ascorbic acid. Your tolerance can increase to more than 100 grams without any issues. And that is actually normal because doctors in the past have used ascorbic acid in amounts of over 200 grams to treat viral pneumonia. Okay, this is what I recommend for intravenous sodium ascorbate and should not be regarded as medical advice. Now, intravenous delivery of vitamin C, it must be buffered to match physiological pH. Most standard intravenous solutions use sodium ascorbate, which is ascorbic acid combined with sodium bicarbonate. The pH of pure ascorbic acid is just way too low for plasma delivery. Now, intravenous delivery of sodium ascorbate, to me, is a really excellent way to support the liver, which is now working overtime to produce huge amounts of haptobilin-carrying macrophages. And the high systemic oxidative stress from pro-inflammatory cytokines can be attenuated by IV sodium ascorbate delivered continuously. Now, the continuous delivery of IVC during waking hours, to me, should be given at the rate of 500 milligrams to 1 gram per hour, depending on severity. This high amount is necessary because the body cannot reuse or regenerate sodium ascorbate in case the individual cannot ingest ascorbic acid. So this is what I think. Combine oral ascorbic acid and IVC as perfect treatment for COVID-19. Oral ascorbic acid plus IVC is a powerful two-pronged attack. IV sodium ascorbate supports haptoglobin regeneration. IV sodium ascorbate provides electrons as an antioxidant, and IV sodium ascorbate frees ascorbic acid to support heme regeneration and immune cell functions. And oral ascorbic acid, as I showed you today, actually stops cytokine storms. Thank you very much. That's the end of the presentation today.
So let me just introduce Dr. Kenneth Wilgers at the bottom. Ken, what is your summation of what Doris just put together?
Well, this is the reason why this is the third session like this I've been on with her, because I'm amazed also. The amount of work and the amount of research that she's compiled and organized, this is unprecedented. I have not seen this mass of information put together in such a way that people can understand it like this before. I think it's great. I think, I think mainstream medicine is completely crazy to not just jump on this. I see people dying that shouldn't be, because nobody's doing this once they get in the hospital. I think one of my values here will be
joke. That's a joke, by the way.
Yeah.